All right, everybody. It is the 20th of May, 2020. We are here at Community Conversation here in Athens-Clarke County. I'm Athens-Clarke Mayor Kelly Girtz, and I have some fantastic guests joining me today. We have County Commissioner from District 5, Tim Denson, in his first term on the commission. I've been very grateful for the collegiality we've shared on the commission. I think he's going to be a fantastic contributor tonight. We have from our Housing and Community Development Department, Director Hayley Banerjee. Evening, Hayley. Good to see you.
Good to see you.
And last but very not least, we've got from Advanced Behavioral Health Services, the Street Outreach Coordinator, Michael Bean. Mike, thanks for joining us tonight.
Thank you.
So given the guests that we have tonight, we'll primarily be talking about community needs, and the nonprofit sector. And so I just want to begin with Hayley. Hayley, talk a little bit broadly just about what housing and community development does under normal terms for people not familiar with the work of the department.
Sure. So I'm Hayley Banerjee. I'm the director of the Housing and Community Development Department, or HCD. And the bulk of the work that we do at HCD is administering federal grants from the Department of Housing and Urban Development, or HUD. So we administer funds to local agencies to carry out projects related to affordable housing, homelessness, economic development, workforce development, youth enrichment. So there's a wide spectrum of community development efforts that we support in this department. And that's a pretty broad umbrella, but at the core of what we do, we're really focused on being the advocate for individuals and families in Athens-Clarke County that live in poverty and who are vulnerable. I tell people that we are the only department within the unified government that focuses solely on the needs of people living in poverty, and our staff takes that very seriously. So we're very excited to be able to talk about that work here tonight. So part of that work in administering those grants is really continuously learning from the community what the needs really are. So we do a lot of listening. We've worked very closely with the Athens Wellbeing Project to listen to what the needs are based on that data, that survey that's gone out a couple times now in the community. Since the Mayor and Commission funded the Neighborhood Leaders Program within Family Connection, we've worked closely with that program to listen to what those neighborhood leaders are seeing on the ground and helping us determine what those needs are from that more qualitative level. Our department also works really closely with the Athens Homeless Coalition. We work with them in organizing our annual point-in-time count of the homeless population. We work with them on measuring progress towards preventing and ending homelessness in this community. And we're also part of the nonprofit training series, which is a partnership between the Athens Area Community Foundation, the United Way of Northeast Georgia, the UGA Institute for Nonprofit Organizations, and the UGA Office of Service Learning. And that's a partnership that we're really proud to be a part of, because though we review a lot of applications and unfortunately cannot always fund every single organization, we're always really grateful that we can point organizations in the direction of that resource that offers free and reduced cost trainings for nonprofits to really build that capacity. So hopefully we see them with a more successful application the next time.
And correct me if I'm wrong, Hayley, you actually had a life in a nonprofit here in town before your life here in unified government. Is that right?
That's right. I previously worked at Athens Area Homeless Shelter as a program coordinator and worked as a case manager for Advantage Behavioral Health Systems before that.
Great. And so, you from your description are always really wanting to get that ground eye view of what the community needs are and how they can be best met. What are you finding here amidst this crisis period with the members of your department?
Yeah, and that's been one of the biggest challenges, I think, in the initial stages of this emergency response. I think I spent the bulk of my time just on the phone, calling nonprofits and other community partners, trying to hear from them. What are you seeing? Are you able to continue your operations as is? What we saw is that no, they were not. Are people able to get the PPE they need to keep their staff safe? Are people able to see people face to face? Are we able to modify services to do kind of contactless delivery of different resources? So one of the challenges has been, I think that we're a community that sometimes we hear frustration about being very focused on assessing, doing surveys, doing reports, all these kinds of data collection efforts. But in this kind of circumstance where things are changing rapidly and guidance is always changing on what best practice is to keep people safe, we're finding that it's hard to know exactly what the level of need is and that things can change pretty rapidly and emerge pretty frequently. So things like food assistance, we made some assumptions early on that food assistance was going to be a really big need. And we have seen that. We've seen certainly the community has stepped up, and our nonprofits and churches and other community groups have really stepped up to provide and meet that need. We're also, I think I personally, and I know our department, suspected that rental assistance and that kind of financial assistance to prevent evictions and homelessness were going to be really big needs. What we've seen as we've stepped away or gotten a little further down the road is that we suspect that things like the stimulus checks and unemployment have provided a bit of a buffer where we haven't seen quite the same level of need that we expected to see. But we do anticipate towards the end of the summer when some of those benefits run out, that's likely to increase. And we're looking at things like the United Way's 211 data to kind of gauge where those needs are so that we can be thinking ahead and trying to provide those supports in place in a more proactive way as much as possible.
That's helpful, Hayley. And Michael, you, of course, in your life as street outreach coordinator, work with some of the very most challenged members, unsheltered persons and homeless persons in this community. But Michael, just for introduction for our listeners, talk a little bit just about the nature of your work, again, in normal times, and then talk about, what unique situations you're encountering in this last 8 or 10 weeks.
Sure. As street outreach coordinator, my primary role is to meet and engage people that I meet in the community who may be facing or experiencing homelessness, form relationships, get to know people, and make kind of quick and dirty needs assessment and see what someone's needs are, and then respond by linking that person with the services that we have available in the community. That's a really broad range of domains that includes things like housing, food services, legal assistance, job assistance, and a really wide variety of things that probably you wouldn't even anticipate. The needs are broad. And so kind of the flip side of that role is getting to know and forming relationships and partnerships with the organizations themselves, which include nonprofits, government agencies, faith-based organizations, medical care providers, mental health providers, and the like. So that's my role before, and really, in a sense, I'm doing the same thing. However, it's through a totally different set of circumstances. Obviously, medical care and testing, and also housing have become really top priorities, and really, even in lieu of, say, stable long-term housing, which is kind of our ultimate goal, simply the ability to shelter in place and the ability to stay isolated and monitor communities for symptoms and coordinate testing opportunities. So that kind of scratches the surface on what I've been looking at recently.
And Hayley, your department has administered some of that aid to those who Michael's partnered with. Talk a little bit about that kind of first delivery of aid and what's out there on the street now that your department's helped facilitate in the last 6 or 8 weeks.
Sure. And like Michael said, I mean, the needs were already there for the homeless population prior to this crisis, and we're seeing the same kinds of needs there. I saw in my professional networks a phrase that's been going around is that housing is healthcare, and that's something that we really realized early on, and we're able to thankfully provide with Mayor and Commission awarding some funds for the ability for shelters and those who are unsheltered to really shelter in place in a local hotel. So we've been able to provide that kind of shelter and isolation to keep people safe who would otherwise be quite vulnerable. We've been able to provide some supports in terms of hand washing stations and now portable restrooms. So those have been in place really since when this crisis began, and and remain in place today in key areas that service the homeless population. We've been able to provide some supports for staff to have the PPE necessary to do their job safely or as safe as possible, to provide cleaning supplies, and to provide some additional staff supports for agencies to keep their services going, or to be able to open up where they didn't often operate during the day. Like a shelter can open up for laundry and shower services now. So really a broad spectrum of homeless supports we've been able to put into place with that funding.
It's great. No, and it's interesting to hear you describe things in those terms. Nationally and globally, we've heard a lot about the risk factors associated with sort of more deep conditions, should one become symptomatic with COVID-19. And I would have to imagine that there's no greater risk factor than being unsheltered. And so that notion of shelter as care, as health care, really makes a lot of sense. Tim, I'm going to ask you to dive in. What are you kind of seeing, or what are your curiosities about the aid or the opportunities that are underway now?
Yeah, I mean, I really appreciate this conversation happening, and it's bringing to light a lot of the things that I've been grappling with as we work through this. I mean, something that the Mayor Commission, of course, has to work with also is the legal hurdles, a lot of those being presented by the state that kind of block us from maybe providing the funding that could help provide this aid in a more direct manner. And I greatly appreciate Hayley and HCD working with us to be able to find creative ways, to get around that. But I guess I'm just going to ask a question to both of y'all, and just as honest as possible. But how do y'all feel like where is this money going to be best spent? We're talking about very finite. We're in the budget season right now. We have very finite resources. With that in place, especially when we're talking about our homeless neighbors, what is the best way that we can be spending this limited resources that would have the best impact on those populations? If you controlled the purses, it's helpful. It's helpful input for me. I'll say that personally,
Hayley, we'll start to you and then kick it over to Michael.
Okay. Well, I agree with Commissioner Denson's sentiments that we've faced some hurdles with some of the restrictions on our local dollars. And I know initially when I thought about my personal feelings about where this money would best be spent, I thought about the 9,000 households that at the baseline, in the best of times before all this, they were living below the federal poverty level, and about 20,000 households living at 200% of federal poverty level. And we have needs in this community that are not met even in the best of times. And so to me, thinking really critically about the need for rental assistance, mortgage assistance, utility assistance, those really key financial supports, I was hopeful that we could utilize our local dollars in that way. And of course, we've had some issues along the way with the gratuities clause, but
that's right. Yeah. And for listeners out there, the Georgia state constitution prevents local governments from, essentially providing targeted aid unless it's a fee for service kind of a situation, or unless we're in what the state may term a quote indigence situation. So, exactly what you're describing, Hayley, the idea to provide a rental or mortgage buffer for somebody isn't as easy as it might be in a California or a New York or Massachusetts. But I apologize, I interrupted you. Go ahead.
It's okay. And so in light of that, I think we've had an application for indigent services, so low income supports, that closed last week. So we've been reviewing those applications, and the parameters that we set for that, those eligible activities, were food assistance, resource distribution, and homeless services. So those were the three key areas that in conversations that I've had and our staff has had that seemed to emerge as the biggest needs that we could legally spend our funds on. So I'm convinced those are still big areas, and that resource distribution piece in particular, that's a pretty vague term, and it can cover, I think, things as wide as, transportation assistance, prescription assistance, if you're vulnerable and can't just go to the grocery store or pick up your prescriptions. We aim to have that application be as kind of vague as possible to allow for, I don't know every single thing that's going on the ground that's kind of taken up in this grassroots way, and we were really hoping to see some really creative applications. So I think those 3 areas where we can spend funds are to me what would probably be most helpful right now. And the good news, at least, is that we do have some federal funds that we anticipate coming our way, additional funds that we can spend on things like rental assistance and utility assistance for low-income households. And we're hopeful, pending some guidance from our federal government, which has not moved quite as quickly as we would have liked them to move, we're hopeful that that can maybe meet part of that gap where we can't spend with our local funds.
And Hayley, if I can follow up on that specifically there. So as y'all go into the distribution for that, it's $830,000, I believe, right? Is that correct? An additional. But because of that gap, a lot of that being created by the gratuities clause of the state, are y'all looking at really kind of moving that money in that specific zone that we're kind of blocked with other revenue to be able to help with in that rental assistance kind of area, since we don't really have other resources there?
That's certainly what staff feels like would be most useful in light of, the restrictions on our local dollars. And it's something, again, it's a need that is there even in the best of times that we don't meet. So it's certainly something that we're looking at as staff, and again, pending whatever guidance that HUD gives us on what we can actually spend those funds on. We'll certainly be looking at rental assistance and mortgage assistance, utility assistance for those purposes.
On that specific topic of HUD guidance, Hayley, has HUD indicated when they're going to provide some final rulemaking about expenditure of what's technically called this CDBG supplemental stash of funds? I think the federal government allocated $5 billion nationally, with an initial allocation to cities and counties. And we received, as has been noted, an indication that $830,000 would be coming our way. But when are we going to know how we can spend those dollars?
Well, the frustrating part is that we've been hearing that it will be soon for quite a few weeks at this point. So we're hopeful that in the coming weeks that we will have that specific guidance. But I can tell you our office is trying to be as proactive as possible and piecing together the guidance that is out there. We've pulled together some draft application documents, and that's what we would anticipate is that we would open up for an application process in addition to our regular CDBG process. We're trying to prepare and make some assumptions where we can so that we're not kind of playing from behind once HUD finally does get that guidance to us. So I wish I had an answer for you because it's been very frustrating, but we're hopeful that it will be soon.
Yeah, and in some ways, of course, parallels the challenges that people have had with payroll protection and EIDL funding acquisition and other things. Michael, I want to kick it over to you to follow up on that same question that Commissioner Denson had. Where do you really see the gaps right now? I mean, you mentioned healthcare for unsheltered persons being a real need earlier, an ongoing need, certainly. The opportunity to be safely sheltered. One of the challenges is that so many of our traditional places for unsheltered persons are congregant settings where people are literally on top of one another on racks of beds, which, when you're trying to avoid transmission of a virus is not the ideal scenario. So I'm interested in hearing your thoughts.
From my perspective, I'd like to speak on 2 points. First is just kind of discussing my role and what I've been doing in my position over the past 8 to 10 months. And really, I feel really good about what we've accomplished and the partnerships I've made and the victories and the impacts that we've had so far. However, in my role, I'm really just scratching the surface, I think, on what we need in Athens. Really, I would like to expand the breadth of my program and really be able to touch more individuals and over a greater geographical area, and also kind of improve the depth of my program, which means the ability and the resources to spend more one-on-one, face-to-face time engaging individuals. So really, I think to carbon copy my position or to grow this program, I think is a great idea. And I work for Advantage Behavioral Health Systems, and they're in the process of expanding the program and hopefully bringing another case manager on to support my role. But really, we could do it tenfold, I think, and still not solve this issue. The thing about Athens is there's so many great service providers and resources and healthcare facilities. However, it's navigating that system that's really challenging. It would be challenging for someone like me, but particularly so with someone who doesn't have a reliable phone or transportation or shelter. Makes it really, really difficult. So that would be one point. Another, and I really would just like to take this opportunity to tout kind of the housing first philosophy. And I think that's a worthwhile investment that's evidence-based and also has proven to be cost-effective. And really, Hayley mentioned kind of the emergency shelter that we're providing at a local hotel, and that's for individuals who are particularly susceptible to the virus, facing homelessness, but also have underlying medical conditions or are over 65 years of age, and makes them particularly vulnerable if they were to catch the virus. And so that's great that we have shelter and showers. However, I've worked really hard to work with partners to provide a real wide variety of wraparound services for those individuals. So the people in this program are also receiving intensive case management, telemedicine calls from a partner physician, the ability to do laundry services, limited transportation to a degree, and monitoring and safety being provided, as well as food. So I think it's a very interesting model on a small scale that we're very ambitious about exiting people from this program at the end of the period there, at the end of this pandemic, into long-term stable housing.
That's helpful, Michael. I've long been interested in the housing first model, and curious about how we may be able to use some capital funds that we receive from the federal government in the coming months to not only manage this crisis, but potentially create a long-term foundational platform of the sort that you see in some other communities. And certainly there is some housing first activity in the community, but I remember an early conversation that Hayley and I had after I took office in my role as mayor about what prospects would be out there. And, to think right now in 2020, if we had 50 or 75 essentially efficiency apartments to provide that environment in which somebody could safely be sheltered and then safely pursue whatever those other personal needs or life needs or medical needs may be, that creates in my mind, and it would seem that the data bears out that it creates an environment in which you can better work on continuing education needs or healthcare needs or substance disorder needs that are just harder to handle when you're literally living under a tree in a tent at best. So I do hope that that's an area where we're able to move forward. And I've spoken a couple of times lately about having had conversations with Senate offices and kind of varying DC-based advocacy groups. And I'm certainly hearing even this week that there probably will be something moving through Congress very late this month or in the first half of June. And so if we can provide some benefits in the crisis, and those benefits can transcend this next 12 and 18 months and just be a permanent part of our management infrastructure in Athens, nothing would make me happier. So Hayley, it was interesting. I got a few questions about that application that we had open that you mentioned you're reviewing right now. Some people asked me, well, why did you leave it open-ended? And and I had to describe that, well, part of this is in some ways a fact-finding operation. By leaving it fairly open-ended, it provides those who are out there on the street the opportunity to say, hey, these are our needs, and this is the scale of those needs, rather than maybe whittling down the application and saying, oh, well, you can't ask for more than $15,000, for example. In my mind, that provided this chance to do some on-the-ground real research as we asked folks what kind of funds they would need. What do you imagine the department's evaluation of those applications to look like over the next couple of weeks?
Well, we've got an RFP or application review committee we've pulled together, which includes Crystal Cobran, our inclusion officer, includes Stephen Bailey, who's in our Transportation Public Works Department, but he's been heading up our food assistance efforts locally. We'll also have Michelle Pearson, who's a very involved community member, and Sarah McKinney from the Athens Area Community Foundation. So we'll be, as a group, reviewing those applications, discussing, and from there, we'll have some recommendations that we'll be able to turn around to Mayor and Commission for approval, we hope, within the next probably 2.5 weeks.
That's great. And certainly, I think everybody's recognized that this delivery of aid in May, June, July of 2020 is not going to be the only delivery that we're going to have to manage, particularly given the uncertain landscape of what the autumn and next winter and next spring look like, particularly in lieu of a well-distributed functional vaccine. So many question marks, and I know that that's a challenging environment for all of us to work in. Tim, you had the benefit for a few years of being on the Vision Committee that reviewed those applications for community development block grant funds that are sort of the natural cyclical flow through Hayley's department. Talk a little bit about just the challenge of seeing so many community needs and having to do some decision making when you probably would like to give more resources to organizations than is available.
Yeah, I mean, it was definitely serving up for those 3 years in the Vision Committee, very helpful to kind of understand, again, just part of it is the difficulties of budgeting things and seeing so many needs, but again, having those limited resources, and real challenge. But I do love the Vision Committee component, since it really brings in the people from this community directly with distributing federal dollars. Again, they're very finite. And I think that the situation we're in now, just along with everything, along with the issues and challenges, everything's just heightened, right? Everything's just a little bit more sharp, a little more clear, a little bit more dire because of the pandemic we're in. I mean, we talk about everything from housing first. Like, again, that's something that's been important for so many years. Just then all of a sudden you throw in a pandemic and lack of housing becomes an integral missing piece of healthcare, as Hayley brought up. Everything's kind of heightened there a little bit. And so, it's going to be even more of a challenge, I think, to be able to distribute these funds. As you brought up, Mayor, I hope that we're seeing this is just the first phase of many phases of federal dollars coming through, so that we can make sure that we are, spending those things and making them go as far as they can. I think the big challenge here, and this is going to be a challenge for our entire community, is looking at, again, because of the pandemic, certain needs are being heightened and therefore need to be highlighted. And, at times I know that we would get requests, and I was on the Vision Committee, from things for summer camps or, different things like that maybe aren't the highest needs now. The priorities change and shift a little bit. And so that's going to be a challenge, I think, for the members of this committee who are going to go through that. I have faith that we'll be able to do that. And I think this whole conversation just highlights the importance of us having open conversation with all those care providers. And I love that we took that integral step of creating that position that Michael serves in now. So not only are we having communications with the service providers, but we're having conversations with the people who benefit from those services, I think, which is a piece that's been missing for a long time. That was actually one question I was hoping to throw to Michael a little bit from some of my own conversations at times, which have been less frequent nowadays because of the situation, but with just some of our homeless neighbors. What are you hearing from the individuals who are living on the streets right now, and some of the ones who are using the shelters and some of the ones that aren't? How are they dealing with this? What's their perspective? How do they feel like that these resources are getting to them? Just what are you hearing from the individuals directly?
That's a great question, and something I'm asked quite a bit. Really, my answer might surprise you, but to be honest, COVID-19 falls pretty low on the radar of a lot of people that I deal with and work with. And as hard as that is to believe, I think it's telling of the situation that a lot of people are in, which I call either crisis mode or survival mode, where people really are trying to figure out how they're going to get by for the next hour or 2 hours or day and stay safe and acquire food and get out of the rain. So in that sense, it's pretty low. At the facility that we're running, at the hotel facility that we mentioned, we placed it front and center because safety is the top priority there. So there are people, our participants do know about social distancing and the benefits of wearing masks and those type of guidelines. But in general, I would say people are affected more indirectly because a lot of the services provided in Athens come from University of Georgia, student volunteer groups, faith-based organizations, so a lot of those have discontinued, but even the local shelters, Homeless Day Service Center, Bigger Vision, Athens Area Homeless Shelter, have reduced, or Sparrow's Nest, have reduced services or curtailed services to keep their staff and their clients safe. So that's really how I think people are feeling it. Access to clean drinking water that is delivered on a regular basis by the Backpack Project, a University of Georgia student organization, has stopped. Bigger Vision has curtailed their services they offer, although now they're starting to add those back into their schedule. And same with Sparrow's Nest. So I think it's just that much harder for people to access food, water, available showers, laundry facilities, and the shelters themselves have had to reduce the number of clients that they can accommodate each night.
Yeah. Okay. That does. It makes a lot of sense. I mean, that, like you said, it's the hierarchy of needs. I mean, COVID-19, while it maybe affected a lot of us that already had some of those basic needs provided, it's a big change. But whenever you're already trying to figure out how you're going to have shelter during that storm and where your meals are going to come from, it's
you think about all of these providers as being sort of this web, and if suddenly, just due to dislocation, university students going online, and a host of other issues in the moment, half of the strands in that web are suddenly gone and disappeared. You really no longer have a web that's going to catch somebody so much as you have some dangling tendrils that are going to be tough for somebody to hang on to. No, that's great perspective, Michael. Sad perspective, and obviously, one of the things that I think every policymaker in this community and everybody who's here with us today wants to see is that those underlying foundational circumstances are solved in the long term. But we know that in the getting from here to there, we're going to be on a journey, and just figuring out how we can successfully manage to keep those steps on that journey going forward amidst this time is tough indeed.
Well, I'd just like to add, while we're on this topic, that the organizations that I mentioned that are still running have really stepped up and really are making the most out of the resources that they're given, while also maintaining safety for their staff and for their clients, and to fill in some of those gaps. And not just those organizations, but local citizens, local businesses. Spoke to several restaurant owners who at the end of their shift or the end of their day load up to-go meals in their cars and drive around Athens and hand them out to people who receive them. So a lot of people in the community are really stepping up to fill in some of those gaps.
Yeah, and that's, of course, a consistently amazing part of this community is while there are challenges, that there are so many giving and willing people to take of their time, take of their excess funds, and look for creative solutions. Yeah, I mean, the number of times somebody has randomly called me at 9:00 at night and said, "Hey, we just got done with this meeting and we had 10 pizzas left. Where should I take them?" I mean, warms my heart all the time just to know that I live in that kind of town. So Michael, we're going to get to some sort of random listener questions in a couple of minutes, but before we transition to that, I just wanted to ask you, for the listening or viewing audience, if somebody sees an unsheltered person or a person in need, what kind of outreach could an individual best do who wants to provide some help right now?
Well, I would have a different answer for that if you asked me 3 months ago than today. Hayley and I spoke before, and we thought just for the purpose of this production, maybe to centralize or funnel kind of those type of requests through Hayley. So she'll provide some contact information. Really, the best thing I would suggest now, if there is an issue or an incident, people can reach me personally. However, I would suggest donating to the service providers is probably the best way to help. And there are a bunch of them. I'm not going to list them off, but Hayley and her staff would be glad to direct people into that direction. I'd also offer, if you're interested, I do street outreach, and shockingly, I've had people reach out to me directly and deliver gallon jugs of water or 20 or 30 boxes of food and other items like that, specifically to me outside of my apartment. And I promise you that those will go in my car and directly into people's hands.
Well, Michael, thank you so much for the work you're doing. We really appreciate you being here tonight. So Hayley, really to you the same question then, if viewers and listeners want to provide some support, particularly for those who might be in need of food or shelter or sanitation or housing, how could they best direct those efforts?
So I'd encourage them to reach out to our office, and they can reach us by phone at 706-613-3155, or on our website. We've got contact information there at www.ACCGov.hcd or .com/HCD. And from there, the needs from organization to organization will vary. And I think the pretty consistent things along the lines of food, of cleaning supplies, hygiene supplies, water, those are kind of the basics, sometimes sheets or clothing still, as some of those services that Michael mentioned have limited their services. But we would be happy as a staff to help connect you with organizations to kind of match you up with whatever you might be able to offer. And I want to echo Michael as well. It's been really, in all the darkness that there has been, I think it's been very encouraging to see how organizations have shifted, how they have stepped up services where they were already providing pretty incredible services. That we've got, even ACC employees that are helping out with our organizations and our transit and solid waste departments. Those are the things that keep me going day to day. And I just want to express our appreciation as a staff and as a government. We're really grateful to be a part of this community.
Absolutely. Well, thank you for the work you're doing and for all of your staff too, Hayley. We really appreciate it.
Thank you.
Kelly, if I can have
Please.
a short follow-up to Hayley on this. And this is one of the things that I've just seen some challenges myself in trying to connect people to resources, and some of the discussions I've had with some of the neighborhood leaders is when it comes to the food distribution, and it is amazing. We have so many people out there giving and providing stuff. But at times it's been a bit confusing because we have so many people working, not necessarily in hand with each other, but working singularly. And it gets some confusing sometimes. I get a call on a Wednesday morning of like, where's some food distribution? And then I kind of have to spend an hour to find out who's distributing food on a Wednesday and where is it at. Because it kind of is, I wonder if there's just a way that we could have better coordination with that. Even if it was just a website or a spreadsheet that everybody was kind of plugged into, and also maybe like, again, some preferred distribution sites so that we don't have a moving site every single day of the week. Instead, I can just tell somebody, it's like, hey, I know Oglethorpe Elementary School, somebody's out there every weekday. I don't know who it is, but you can get food there. I wonder if
some kind of clearinghouse.
A little bit. I wonder if there's any work on that.
And we've definitely talked about that as a staff, and yes, and again, before all this happened, because there are so many great services in the community, it can be really difficult to navigate that web. And certainly as things change week to week, day to day, and locations change and volunteers change, organizations change, it is kind of that moving target of kind of keeping up with what's being offered day to day. One thing that I would encourage for organizations, if anyone is watching, to do is really keep in contact with Mark Madison at United Way, who really manages that 211 system. And again, things change pretty rapidly these days, but as much as possible, plugging in with Mark so that goes into the 211 database, and that their call center and their website is updated with that information. That would be a good existing way to kind of filter those requests. And we try to keep updated as staff too. And I know, again, because things change, we're not always as up to date, but we're working on ways of trying to keep up with how things change rapidly. So I appreciate you bringing that up.
So Tim, I think we've been sent in a handful of questions on some other matters that the public wanted to know a little bit more about kind of in the midst of this crisis period. Do you want to go ahead and help me tackle those? Maybe we'll see what kind of assistance we might be able to provide out there.
All right. Yeah. Let me pull those up here. Any conversation questions? All right. We'll just kind of go down the list here. Right. So I'll just read through here. One, Katie Dillard wrote and asked, in the 30-page governor's executive order just signed days ago, there are no guidelines for churches given. In fact, religion or religious organizations are not addressed at all in this document. In the short section about nonprofits, it addresses the workers and those organizations. In the governor's order, there are guidelines for restaurants, cinemas, other places. But are there Athens-Clarke County and or state guidelines for churches and a definitive answer as to when churches may open again?
So definitely a question we've heard quite a bit. And I know that, one of the things that's different in the landscape from one state to another is the clarity, or in some cases like this one, lack of clarity around how different kind of operators can successfully manage as we move through phases of this crisis. Tim, I guess sort of a question probably close to your heart, given that your parents have a ministerial life. Right. And I would have to imagine one that probably every congregation, whether it's a small 20-person street corner church or a very large one like Crossroads, is trying to figure out. So in anticipation of this conversation, I did a little bit of digging, and as Kay noted, there really is nothing from the state directly. This state didn't provide definitive requirement that places of worship sort of cease activity over the last several weeks. There were some encouragement certainly to do online as much as possible. But what I was able to find is that there is some CDC guidance, Centers for Disease Control. And I will email this to Kay, but for anybody else out there listening, there is a webpage on the CDC site termed Interim Guidance for Administrators and Leaders of Community and Faith-Based Organizations to Plan, Prepare, and Respond to Coronavirus. And one of the things that page does is talk about, if you're in a community with very high social transmission. So, in Georgia, you might think of Dougherty County or Hall County as those kind of places where there's very rapid spread, and they've got a level of guidance for that high transmission environment. And then they have a low to moderate transmission set of guidance too, which is where I think, we would frame Athens-Clarke County. I think just due to largely good behavior by institutions and large employers and large organizations here, we really have kept our positive cases per 100,000 lower than almost any other metro in the state. I think the only metro lower than us right now in the state is Chatham County, Savannah. Every other one is higher, but we still are having some cases, and we certainly want to see every kind of provider, restaurateurs, retail, and others do the best thing they can. And so I'd reference that CDC website. They certainly do recommend continuing to do as much online work as possible, or if you're going to do live work, have that be very small group where there can be distanced. I grew up Catholic, and when you grow up Catholic, you take the chalice at the front of the church from the priest and drink from it and of course, embrace each other and shake hands. And, unfortunately, that's the kind of physical contact that this virus thrives upon. And so I'd guide anybody to that CDC site. I think one of the things that Kay asked is a very specific date for when we would recommend, and we don't have that guidance yet. I mean, if there's any corollary I would offer, it's that we are not encouraging large gatherings in our own facilities, at least through the end of June. And so I would let that be a guide. Tim, I don't know if there's any follow-up or if there are thoughts you have about that challenge.
I mean, my parents down in Florida have been, they've moved a lot of their ministry online, doing a lot of Zoom church services. So that's obviously the best way to go. I know that a few churches, including here in town, have tried out the drive-in church service, which obviously requires a little bit of space. It's a little more difficult. But those things always still, obviously the best thing though is just if you're in your home, you're completely safe there. But another thing I did look at and saw was even going back to just the history and back to the 1918 pandemic, in which Athens also fared pretty well compared to other places. At that time, I know a lot of churches moved their ministries outdoors. If they did meet, they met in still obviously small numbers is important. Outdoors is much safer than being indoors if that is possible. And I think a lot of these things just follow the guidelines that exist for other just normal life. Don't go indoors when you can't. Don't be in close proximity to each other. Don't be in large groups. So I think it's an important thing here, which everybody, all these ministers know and stuff anyways, that the church doesn't necessarily isn't the building, it's about the people. So I think if those people are meeting online or wherever else, that church is there. And so I think that I'm just proud of the organizations, the churches here in town, how they've been really creative at taking on this really difficult task.
Great. I agree. I mean, it has been amazing to see, and certainly many of the downtown ministries have provided some support for the kinds of work that Michael and Hayley support. I'm actually meeting very early Friday morning with the advisory group for Our Daily Bread, who operates out of First Baptist Church. And, it's great to see this multi-denominational organization kind of all with a common mission. So we love that aspect of Athens life. All right, Tim, next one's kind of interesting. Maybe Hayley or Michael can help us with that. What's the next question?
Yeah, this one is interesting. Are hug curtains safe? Hug curtains. They look safe, and after quarantining alone, I really miss hugs. I understand that. The human touch is so very important, and this comes from Paula Elliott. And Paula, you are correct. I don't know if y'all have seen these hug curtains. I saw a video on Facebook today of a curtain in the doorway and a grandmother hugging her I think it was her granddaughter through this plastic curtain with armholes. So hug curtains. What do y'all say?
I think the SNL season has ended for this year, but maybe when they come back in the autumn, there can be one of the SNL skits all around the hug curtain. No, this was new to me too. I have to say though that one of the real challenges in this moment is not being able to physically embrace people like you normally would. Shake somebody's hand, give them a hug, hang on to them at a rock and roll show and throw your fist in the air. Just all those things that, we love about the human experience. I was looking for some information about the sports community sort of in terms of another sort of question about public gatherings the other day and stumbled upon this video that I think is only a couple days old that you can find on the Wall Street Journal website. And it does a sort of great job just showing a diagram of a sports arena and showing how that is such a challenging environment. And I think it gets to, so many of our kinds of preferred activities here, be it faith activities or just social environment activities or or sports or music environments. So it's tough. So Paula, I feel your challenge. I wish I could provide more specific guidance on the hug curtains. All right, what's up next, Tim?
All right, this is a pretty important one that I've been hearing a lot about here. Tony asks, to what extent is ACC coordinating with UGA with respect to being ready for students returning, and specifically what the protocol will be as far as testing and responding to students contracting COVID-19? While this is UGA's responsibility, I ask because the influx of students will clearly have an impact on ACC in general, and knowing what UGA is preparing will be helpful for the entire community.
Yeah, I actually, even prior to getting these questions, I'd reached out to UGA yesterday to find out a little bit about kind of what their timeline looked like, because it seems like as the weeks have gone on, we're beginning to hear very specific plans from some institutions, Notre Dame, University of South Carolina. Certainly we know that the California institutions are almost purely virtual this fall, with the exception of laboratory kind of settings. And then the Atlanta Journal reported just over the last 24 hours that there is a sort of draft document that the University System of Georgia is reviewing right now. So we are staying in close contact. One of the interesting things about some of those institutional plans has to do with the idea of really not creating the vectors that would be existent if students were coming and going from town very much. So what some institutions are doing is compressing the semester without any breaks other than a Saturday and Sunday weekend, so that you wouldn't have students going home to Alpharetta or Savannah or Louisiana or other places around the country, around the world, and then coming back. And so those schools are essentially closing down prior to Thanksgiving, and then having a couple of weeks of digital activity at the end of the semester, and then beginning the winter break. I've certainly floated that as what seems like a viable model to the university, and in conjunction with that, also suggested to the university, like with the broader public, that we really want messaging and behavior to be on the same page with the university community, with the business community, with the other major institutions in town, like Athens Technical College and the school district. And so one of the things that staff internal to the government has been working on with some of those institutions, and also with public health, is some very common guidance and associated signage, so that in a couple of weeks we'll be able to say, hey, we all buy into these 3 very simple, easy to understand activities. Wear a mask if you're out in public. If you do need to be in a retail environment, is obviously a clear one that each of us can do for others' safety. So to Tony, we are working to make sure that we understand one another's needs, and that we're going to be fully prepared for whatever level of student activity happens this fall. Sort of in conjunction with that, I'm going to be on a call with about a dozen mayors tail end of next week, mostly university city mayors, just so we can brainstorm and talk through, hey, what are the things we're not thinking about? I mean, one of the things that's on my mind right now is what kind of restrictions ought to be on nightlife, for example, through the autumn. And I think we're going to have just very clear conversations about what's viable and what's not. Because, if we saw normal autumn nightlife behavior in the midst of COVID land, we would not be a happy place. So, all right, Tim, what's up next?
So this next one is a pretty specific one, but is there any way to implement a disc golf pass at Sandy Creek? It just reopened, so we do not have to hand over cards at the gate. The state parks offer a yearly disc golf pass for $35. I would feel safer being able to flash my yearly pass and a disc golf pass at the gate.
Oh, good question. And I did float this to Kent Kilpatrick, the Leisure Services Director. We do currently have a dozen game pass that's a $10 pass, so you're paying less than a dollar a game there. And he said you can just hold that out the window and they'll clip the pass with the puncher and you can move on. But simultaneously, they are exploring the prospect of that annual pass and just trying to determine how well utilized that would be. For those who don't play disc golf under normal circumstances, if you just want to go play an individual game, you pay $1 for every game visit to Sandy Creek Park. And just want to reiterate what I think some other people have heard through community outlets, that Sandy Creek Park is now open again. And while not every aspect of that park is open, you can enter Sandy Creek Park, go for a hike, sit on a bench, hit a baseball with your child, as I think I will probably be doing the next day that it's nice enough to do that, because mine is very restless in the house. Tim, I don't know the level of restlessness with yours over there.
Yeah. You missed the cameo from my daughter a few minutes ago here, but yeah.
Nice. It's been one of the great things about these digital meetings here in recent weeks. I get to see so many family members coming and going, and when I'm lonely for other human contact and the diversity that we usually get through the week, it's nice to see your wife and daughter float into the room. Tim, well, Tim, any closing thoughts for the public?
Well, I had one more question that was sent directly to me, and I think that the individual just wasn't sure whenever I shared it on Facebook exactly how to get the question in. But this one was dealing with just broadband access, and I mainly bring it up because even my feed is breaking up a little bit. I've seen that. But Susan asked, what can be done to better ensure broadband access to more rural parts of the county now that the COVID lifestyle is demanding even more access to broadband for students and for people working? And I don't know if this is something that Hayley could possibly throw in a little bit if you had any ideas too. And I think that this question was more about short-term solutions, in which I honestly say that I'm not so sure about them either. But I know it's something that a reality that a lot of people are dealing with right now.
Hayley, do you have some kind of specific information about what folks can do for digital access? Obviously, as the school district year comes to a close, it's not an issue as much for the next couple of months, but certainly has been over March and April and May.
Mm-hmm. That's something I'd like to take back to staff, and maybe we can send something out with a little more information. I can tell you that we, as a department, are required by HUD to look into broadband access and to consider that as we think about spending our federal funds. But that would be more a long-term kind of support that we might be able to put in place eventually.
Right, and we do have some long-term plans that are going to be SPLOST funded for greater broadband access. I'll also note, and I know this just through my life in public education up until about 1.5 years ago, that most of the big name wireless carriers, and I'm not going to provide advertising for them here, but the ones of which I speak, do have a low income access plan. And so most of those are about a $10 a month plan. And some of those involve wired access, and some of those plans involve the hotspots. And so if you go to kind of any of those websites for those, and you look for a kind of low income or public aid plan, because some of their plans are reliant upon somebody accessing SNAP benefits or other public aid, almost every one of the providers has a plan to help you.
Great. Appreciate that.
Thanks for bringing that.
Yeah.
But so important in these days. I mean, and I think probably is going to be increasingly true. We've heard a lot about the digital divide, and I mean, I think the COVID era exemplifies that digital divide more than anything. Well, y'all, sadly, our hour is at an end, but Michael, I can't thank you enough. Hayley, we're appreciative of what you and your department do every day. And Tim, it's been great to have you on tonight. Great colleague, and look forward to seeing you again tomorrow, where we will be discussing the fiscal 2021 budget for the first of a few meetings on that topic. So everybody, good night. This has been Community Conversation. We look forward to seeing you next Wednesday from 6 to 7.